Hi, my name is Max Wilcox. I'm a doctor in veterinary medicine. I've spent my entire life around horses, and essentially my life involves around horses and the culture of horses, and Western horses in particular. My job is very physical. Working around horses are very physical. They're essentially a 1,000-pound dangerous animal to a certain extent. Not that they're not gentle, but they're unpredictable. I was shoeing a horse that was a little bit of a renegade about 18 years ago. The owner, who was more unpredictable than the horse, slammed his truck door right at that moment. The horse kind of collapsed and fell on top of me a little bit, and I was very strong at that point in time. I held the horse off the ground with my hip, and by that afternoon I was experiencing numbness in my back. That evening I laid down, and when I tried to get up and walk, I could only walk about 30 feet. And that was the beginning of my back troubles. That was about 18 years ago. Eventually I had, my back was diagnosed with a couple of herniated discs, L4, L5, L5S1. The only treatment I received at the time was corticosteroid injections. That improved things to the point where I was functional to a certain extent. I had essentially lived the life of a cowboy and a gypsy horse trainer. I went back to school. The entire educational process eventually led to the position I am in right now, which I have my own business. I practice as a veterinarian. Through all this, through the last 15 years, my back pain weakness was very positional. For instance, I slept in an armchair for the largest part of 10, 12 years. If I slipped prone, I'd wake up and I'd have to crawl around and regain sensation in my lower legs. At the same time, I was able to do a lot of very physical things. So it was kind of an odd, my back symptoms and my back condition was very significant, but it was kind of an odd mixed bag. I reached a point in my life where my life had become more stable. I was married, and I was considering or thinking about starting a family, having children. I, for the most part, thought that decision in my life was behind me. But everything was stable. I was financially doing well for the first really good period of time of my life. I had a good business, and I asked myself if I could make it through the next 20 years with the physical handicap or compensations I had to make to protect my back in face of the physical nature of my work. I didn't think I could, and at that point in time I decided to pursue a medical solution. I actually had the ability to do so, so I took a radiograph of my own back with my own radiograph equipment, and it was pretty clear that the lower lumbar spine was collapsed or compressed. It was a pretty dramatic radiograph, and I went from there. I have a father-in-law who I have a tremendous amount of respect for. Lament is one of the most thorough, carefully planned out individuals I've ever met in my life. My father-in-law had received treatment through Dr. Ghosh. Dr. Ghosh had actually prescribed traction for him for his back condition, and everybody has a fear of surgery, and I believe my father-in-law was hoping that I might avoid surgery. He had confidence that Dr. Ghosh wasn't going to recommend surgery unless it gave me the best possible outcome. I followed my father-in-law's recommendation, and I never regretted it. I remember my first meeting with Dr. Ghosh when we reviewed the results of my MRI. One of the things that stands out about that meeting was a comment that he made that I had waited the exact right amount of time to pursue a surgical remedy for my back problems. That there had been 15 years since the original injury, and during those 15 years there had been tremendous advances in orthopedic surgery or back surgery. It was minimally invasive and far less traumatic to surrounding structures, and recovery time was much better, and potential complications were minimized. as compared to previous years and previous surgical techniques. I reported very routine. It was kind of a very routine process, almost a surreal process. I'd never experienced general anesthesia or really been in the hospital in that situation, other than at the time of my original injury. I remember being wheeled into the operating room, being asked to count down to 1 from 10 and making it to about 8. I woke up pain-free, and I was walking the next day with the assistance of a physical therapist. I had some very structured rehab over the next 6 weeks, and essentially in 6 weeks I was back performing a large part of my duties. I actually, against recommendations, but horse people are a little nuts. I was riding a horse in 6 weeks after surgery. I was performing the same duties that I had performed before surgery to a greater extent within 6 months. Within a year, I was better than I'd been in 10 years. I really believe that my ability to recover in such a rapid fashion from my back surgery, it can be attributed directly to the very modern techniques and very modern technology that Dr. Ghosh uses for his surgery. So it was no longer necessary, as it has been for many surgeons, to perform surgery through the abdomen to access the spine, or to lay back large portions of back muscle in order to access the spine. Everything was done in a very minimally invasive fashion, and that minimized healing time and recovery. My experience with Dr. Ghosh was characterized by his compassion. It was clear that he cared about the unique aspects of my medical issues. The overall sense of his technical expertise, I was left with a feeling of confidence that I was dealing with an individual that was entirely expert at all the different aspects of the procedure that he was going to perform with me, and that he had performed them successfully many, many times. Hey, come here.